My name is Angie Lordson. I'm the state director for Nebraska For Us. We are a nonprofit that focuses on federal economic policy that affects low and middle income Nebraskans. So today we've come together and we're going to talk about the increased costs that we're all going to be seeing through the healthcare marketplace, but also just premiums in general are going up quite a bit. And so we want to make sure that we're leaving a lot of space for everyone that has questions about the increased costs and the premiums that we're going to be paying for healthcare and healthcare accessibility today. And so we are so incredibly thankful to be joined by the former administrator of the Centers for Medicare and Medicaid Services, Chiquita Brooks-LaSure. We also have State Senator John Fredrickson with us today, Kelsey Arends from Nebraska Appleseed, and one of my favorite friends, Audrey Horn, to share some of her personal experiences with the marketplace. And everybody will be provided a little bit of time to speak that's on our panel here today, and we'll have time for questions and answers at the end, but also feel free to use the chat to throw some questions into the chat that you feel that we can expand on when we're having these conversations today. At the end, I want you to stick around because we have some really cool community get-togethers coming up so that while we might feel isolated and alone when we're talking about some of these really heavy federal economic policy changes that we're seeing, know that you can come get together with us in the community. And so Emily on our team will be sharing some information and events at the end of this. So please make sure to stick around until the very end. So just really quickly, why we're here, I was thinking overnight and this morning why it's so important for us to be having these conversations. And it always came back to healthcare is so incredibly important and it's personal. Every time we access healthcare, every time we go to see our friends and in our healthcare agencies, whether you are going for just an annual checkup or if you have an emergent need that you need to go see people with, it's so incredibly important to have accessibility, but also affordable healthcare too. That you can afford the services that you need to go and have. I was thinking about the different times that my family has accessed healthcare over the years. I've delivered 3 babies in Omaha, and I've been fortunate that every single time my local hospital that I was delivering at was like 15-minute drive. And so that makes me really think about our rural friends and family, that it's not 15 minutes for many of them. And a lot of the cuts that we're seeing on the national level will be affecting clinics and hospitals within our rural areas of Nebraska. And the accessibility about not having something that's 15 minutes. What if it's 15 minutes now, but what if there's closures to services within those clinics and hospitals that will no longer be available because of the cuts that we're seeing coming down the pipeline? I think about my youngest when he was born. He was born with a repairable birth defect, and he just had a lot of health issues. And by this time he was 6 months old, we had 6 different specialists. And we are so fortunate to have Children's Hospital here in Omaha that was close. And so we didn't have to travel. There's so many families that live in rural parts of our country that don't have a children's hospital close to them. And so I think there's a lot of us that live in urban centers that take for granted how close some of these healthcare centers are. And I just want to kind of lift up a lot of our rural friends and family members that if something comes up, they have to make decisions about, when can we make that appointment? When are we going to be going to seek out that care? Is this emergent? How do we fit this into our lives? Or for us that live in more urban type settings, it's maybe a 15-minute drive. So I've just really been thinking about how the implications of federal policy really affect us in the urban areas, but really in our rural family and friends that kind of live in those areas where it's not as accessible. I was told at my latest dentist appointment that I have a cracked tooth and I need a crown, and they quoted me $1,500 for that crown. And we all know that I'm sorry to anybody that's like a dentist or has friends that are dentists or work in that field, because I really don't like going to the dentist. But also knowing I have to get this done, but how do I fit this into my budget? When is a good time to fit in $1,500 cash into my budget to go get this done? And so there's a lot of different pieces that come into that healthcare affordability, accessibility decisions that we're making for ourselves and our family members. So with that, I do just want to make sure that we kind of get centered on the conversation that we're going to be having here today. So with that, I'm going to throw it over to the former administrator of the Centers for Medicare and Medicaid, to Ms. Chiquita Brooks-LaSure, to introduce herself, but also kind of help frame up and kind of continue this conversation this morning.
Thank you so much, Angie, for having me and really for putting together this discussion today, which is so critically important. And as you said, I am the former administrator for the Centers for Medicare and Medicaid Services. I served for the 4 years of the Biden administration, and I am very proud of what we were able to accomplish during those years, and very concerned about the state that we are in this moment, where for the past year, many of the gains that we were able to make over this country, really over 15 years, have been threatened. I think you started so well, Angie, with talking about just how personal healthcare is. And as CMS administrator, I really saw the spectrum of so many people that CMS takes care of are Medicare beneficiaries, who often are our nation's seniors or people with disabilities, and have totally different needs than people who are covered by Medicaid and the Affordable Care Act. We've made, as I said, incredible progress. At the start of this year, we had reached the lowest uninsured rate in our nation's history, and I think really had an agenda of trying to strengthen our healthcare system. But this year has been a very challenging one that I would say was not inevitable, but it has been a choice that Republicans and President Trump made for the American people. Earlier this summer, the congressional Republicans passed and the president signed into law a tax bill that, while it lowered taxes for some of the richest people in our nation, it cut over $1 trillion from Medicaid and the Affordable Care Act marketplaces. That's the largest cut that we've seen in our nation's history. 15 million people are at risk of losing their health insurance because of that tax law. So this past weekend, enrollment began for 2026 on healthcare.gov and other state-based marketplaces. And now that we can look at the costs of those plans, we are starting to see the full effect of these actions and inactions. It's actually worse than what many of us predicted. Early estimates are finding that premiums have increased by 26%. Many people are seeing their premiums skyrocket by hundreds to thousands of dollars, which makes it the largest single price hike for individual coverage in U.S. history. What does this mean for people? It probably means for many people that they will forego coverage entirely. What does it mean more specifically for Nebraska? For the over 130,000 people who are enrolled in the marketplace in this state, premiums could increase by thousands of dollars. A 60-year-old couple in Nebraska that makes around $83,000 a year could see their annual premiums increase by over $22,000. A family of four earning $64,000 a year would see their annual premiums increase by almost $2,600. I really want to put these numbers in a context. 2 out of 3 American workers are unable to cover a $500 emergency expense, such as a flat tire or a leak in their roof. For someone who makes $35,000 a year, that's around $17 per hour, they're going to see their premiums rise by nearly $1,600 this fall. That's the equivalent of having to work almost 12 hours a day for 18 days straight. And that doesn't account for childcare, gas, or other expenses that you might incur if to increase your working hours, or whether your employer will offer you those additional hours in the first place. Importantly, there are about 12 million adults in the marketplace who are employed by small businesses, self employed, or small business owners themselves that rely on these tax credits. Nebraska outpaces the nation with almost 50% of its labor workforce working for small businesses. That's almost 200,000 small businesses who serve as the backbones to your communities. We should be celebrating these small businesses rather than placing excessive strain on them to afford insurance. The goal of the Affordable Care Act has always been to improve access and affordability within our healthcare system. The extended tax credits are a continuation of that progress that is set forth by the ACA. And while we had and continue to have more work to do to make healthcare affordable and accessible, the ACA has worked. Because of them, we reached the lowest uninsured rate in history. That had ripple effects not only that benefited the over 12 million Americans who gained access to life-saving coverage during the last 4 years, but also to our healthcare system and economy overall. Not only are these tax credits lifelines for millions of American families, they are not unique to the ACA marketplaces. Every type of insurance, such as coverage through your employer, Medicare, Medicaid, TRICARE for the military, they all benefit from government subsidies so that premiums are lower and so that insurers and hospitals participate in the market. For example, for those of us covered by employer coverage, the employer receives a tax break, and so do you, subsidizing your coverage with taxpayer dollars as well. There is no reason why we should treat the tax subsidies for the ACA marketplace any different than we can treat any other type of insurance. Republicans are not only attacking marketplace coverage. The massive cuts the congressional Republicans made to the Medicaid program will have ripple effects that could push Medicaid enrollees, like children with disabilities, adults juggling multiple jobs, and older Americans who rely on home and community-based services, as well as our healthcare system and state budgets, to their breaking points. This harms all of us, regardless of whether or not we personally are covered by Medicaid or receiving coverage through the marketplace. People across the US are already seeing the signs and the warning signs of the Republican tax law. I have been on so many calls over the last couple of months and been hearing about rural hospitals that are closing their labor and delivery units, including 2 rural hospitals in Nebraska. No one in this country should have to forego health insurance because it is too costly. No one should face financial strains on their small business due to skyrocketing premiums. And no one should have to drive hours more for care because their rural hospital shut down. People across this country deserve a healthcare system that is both affordable and accessible rather than one that's making them choose between coverage, affording their groceries, or paying for their housing. And yet, for reasons that are unclear to me, congressional Republicans are choosing not to renew healthcare subsidies for marketplace enrollees. And the tax law have sent us down a trajectory that will force millions of Americans, some as early as this fall, to face this reality and make difficult choices. But I want to emphasize this is not inevitable, that these subsidies can be extended and that we can reverse the Medicaid cuts if Congress will act. And I encourage all of us to talk to our members of Congress and make sure they know our voices are heard. Thank you. And with that, I'll turn it back to you, Angie.
Thank you so much. Before we hand it over to my friend, State Senator John Fredrickson, I do have a follow-up question because I feel like every day that action does not happen pertaining to these tax credits, we lose more people because they could go out on Saturday and look to see what their premiums are supposed to be in 2026. And some of them might look and be like, I'm out. Like, I can't afford this. My family can't afford this. And they just disengage and they know that they will not be able to afford health insurance for next year, even if they're able to come up with a solution, come up with a plan. What is your fear of what this looks like moving forward, even if they do extend the tax credits?
You raise very important points. I am very concerned about the fact that shopping has already begun, and the premiums are higher than they would have been if two things, if the subsidies had been extended before, because and some of the actions of the tax law actually have already taken effect. So what has happened are that the premiums are higher and the market is more unstable than it should be. One thing about insurance is that insurance companies are trying to predict what will happen. And because it has been a very unpredictable year, the premiums are higher than what we expected. And so even if they are extended, they will come down, which we hope they will be extended, but they won't come down as much as they should because it has taken so long. These should have been extended in April. And as you said, I think that people may come and see sticker shock. And if your premium has gone up considerably, you may not come back to the marketplace. This administration has also cut the outreach funding that we had done under the previous administration. And so if Congress does extend the subsidies, it will be imperative for all of us to get the word out to tell people to come back. But I certainly agree that it is really unfortunate that this was not extended months ago, but certainly before November 1st.
Thank you for that. Right now, I want to hand it over to my friend, State Senator John Fredrickson, to introduce himself, but also to start adding to this conversation.
Sure. Well, thank you, Angie, and thank you, Chiquita. That's a big act to follow, and so I hope I can maybe do justice to continue this conversation going. But so I'm John Fredrickson. I'm a state senator. I represent District 20 here in Nebraska, which is sort of the central West Omaha area. I also serve as the vice chair of our HHS committee. So this conversation is incredibly important. Both to me personally, but obviously to Nebraskans at large and to our state as well. So, I'm trying to even figure out where to begin because there are so many things to talk about with this, and I imagine my peers on this panel have also struggled with this as well. I think that. I'll start with this, I guess. The conversation about the increases in premiums is very real. And I'm actually out knocking doors. I was out knocking doors just yesterday, and I had a conversation with a constituent who was going on to renew for the next year, the open enrollment, and was sharing a similar story as what some folks have shared in the chat about the drastic increase in their premium cost. And the constituent was asking me what they should do. They were literally asking, do I just sort of roll the dice and hope that it's a better year, or do I try to figure out how to pay for this? And those types of conversations, when you really think about it, are pretty devastating because we're not talking about rolling the dice on something that I think is optional for folks. Healthcare happens, illness happens, life happens. And so to have people in situations where they are genuinely debating whether or not they are able to have access to coverage it should be a huge red flag for all of us. Another conversation I was having with another voter is, because here's the thing. I mean, we think a lot about this in terms of obviously the ACA, we think about Medicaid, but this impacts everyone. And let me be clear what I mean when I say that, is that, our hospitals, our healthcare system relies on these subsidies to ensure that healthcare is more affordable for everyone. So what happens if we lose these subsidies, if folks drop care, et cetera? it's very likely and possible that private insurers are going to increase their premiums for consumers who are covered on the private insurance industry as well. So, this thinking or this narrative that this is only going to impact certain populations of folks, I think is misguided, in that, we're all in this same boat together. So I think big picture, long run, we're all going to be impacted by this. More specific to Nebraska, we are seeing challenges, big picture healthcare wise, with rural healthcare. Of course, I represent a district in Omaha, which is an urban area, and we're fortunate to have access to a lot of incredible world-class medical facilities in our backyard. I know Angie was talking a little bit about this earlier, but we talk about this all the time on the HHS committee. How do we address workforce shortage with rural healthcare? How do we address access issues? How do we address, ensuring that folks have care within a reasonable distance from their homes? And we have seen, I think it was earlier this year, we did see one rural clinic shut down in anticipation for these types of cuts occurring. And those who are not shutting down, we're hearing from clinics about the possibility of them reducing services that they provide. And these are, again, critical services, things like maternal health, things that, again, are essential for people who are living in these areas to have access to. Another thing I'll share quickly is when we think about, kind of dollars and cents, to bring it back to the economic perspective. And I know that can be difficult to shift to that when we're talking about something like healthcare. But from an economic perspective, Nebraska is consistently a state that ranks one of the lowest unemployment rates in the country. Essentially any Nebraskan who is able to work is essentially working. We have an incredibly low unemployment rate in our state. And not only that, we have one of the highest percentages of people who are working, but also living in poverty. So you think about this kind of from the context of what we're seeing big picture as a state. We have Nebraskans who are employed, who are working, but who are also in need of services like Medicaid and the Affordable Care Act to maintain their healthcare coverage, only to find out that those premiums are drastically increasing. So it is really it's really pretty dire, what we're facing and what we're looking at. And as some of my peers have said before me, this is a decision, this is a choice that is being made. And I know there's a lot of frustration with the government shutdown, and I don't pretend to be in the weeds on the federal level. I'm a lot more on the state level, but there is this question about, should we be willing to forego things like the healthcare premium cost affordability for folks? And I think there's a really compelling argument to say no, especially when the paid for is on the is to provide these tax cuts for some of the wealthiest Americans. And so when you ask anyone that, regardless of political ideology, I think that folks tend to have a pretty fair sense of fairness, right? In this idea of, is it in fact fair what we're doing currently? And I have a lot of concerns about that. So I kind of talked all over the place a little bit here, but those are some initial thoughts I have, and happy to answer any follow-up questions if folks have any about specifically what's happening in Nebraska.
Thank you for that. One of the things that we heard a lot about in the news was the increase in the deficit that we heard about for the state of Nebraska when it comes to the tax bill that was passed this summer. We're currently facing, instead of, it was in the $90 million deficit range, we're now facing a $451 million deficit when you go back into session in January. And the governor has called for a 10% reduction in spending throughout the state that equates up to $500 million. But there's going to be a lot of ramifications from this bill that was passed here within just our state budget. And so I can't express to you enough, and it may be you, John, can help explain what will happen, where they find those monies, and where they start pulling from, and just the ripple effects, because Medicaid is a reimbursement program within our, clinics and our hospitals that we administer here within the state. And so just the increased costs that have come from the tax bill when it comes to Medicaid administration within the state. How do you feel, or where do you think the other senators are at? Where do you think the administration here in Nebraska is at when it comes to funding this, or where do you think everyone is at? Are they having conversations around finding money, and where do you think, as a state senator, they're going to start pulling that money from in order to help fill the gaps?
Well, that's a great question, and I won't pretend to know what my colleagues are thinking, or what the executive branch is thinking for that matter. But what I will say is a few things. One is our economic forecasting board did meet about a week ago, and they are projecting. I think you're correct, Angie. I think it's around a $451 million budget shortfall. So going into next year, we have that shortfall that we're going to have to address as a legislature. We're required to have a balanced budget, as folks may be aware. And that does not even take into consideration some of these upcoming impacts of the federal reconciliation bill that was passed earlier this year. And so specifically what I mean when I say that is that we see with a number of different HHS programs, more administrative costs being shifted to the states as a result of this bill. So things like the SNAP program, for example, things like, you're going to see an increase in state costs for that. And Nebraska is going to have to decide whether or not we continue with those programs in the ways we historically have. One of my biggest concerns is whether or not we do have, whether this is coming from the executive branch or even the legislative branch, I think we all need to be asking, do we have a long-term vision for where we're going here? Because I have yet to really see that. What I mean when I say that is when the governor comes out and says he wants to cut, X% across the board, and then we have this economic forecast, then we have this federal bill all coming in. Nebraska is a fiscally conservative state at a baseline. We don't spend excessively as a state. I think when you really look at the line items of the budget and the state's budget and the biennial budget, we are not, spending recklessly as a state. And so this whole narrative of cut, at a certain point, we have to ask ourselves, what do we believe government's function is, right? Do we believe that government should provide, safety? Do we believe in Nebraskans' ability to access care? Do we believe in Nebraskans' ability to be educated? Do we believe in ensuring that we have robust law enforcement? I mean, these are the basic sort of functions of government that, if we keep cutting, are going to ultimately be impacted by this type of behavior. So I have a lot of concern about that. I think that the state's response to the shift in federal law should be our top priority for the next year. And I certainly hope that that's what the focus is going to be. It's a shorter session, it's a 60-day session, but I imagine the majority of which will be focused on the state's budget.
Thank you for that. With that, I would love to transfer over to Ms. Kelsey Arends. So if you can spend a couple minutes, Kelsey, introducing yourself, but also talking through, kind of expanding on this conversation that Senator Fredrickson just talked about when it comes to impacts that you're seeing within Nebraska and how Appleseed is confronting some of those.
Yeah, absolutely. Thanks, Angie, and thanks to Nebraska For Us for hosting us today. My name is Kelsey Arends. I'm a senior attorney with the Healthcare Access Program at Nebraska Appleseed. If you haven't met us before, Appleseed is a nonpartisan, nonprofit organization. We fight for justice and opportunity for all Nebraskans. And our healthcare work is focused on ensuring that all Nebraskans have equitable access to quality, affordable healthcare, because we know that our communities are healthier when everyone has meaningful access to care. And in our healthcare system here in this country, that really requires access to coverage, access to insurance as the first step toward being able to access the actual healthcare that we need. That's why we're fighting for Nebraskans to continue to be able to access these enhanced premium tax credits that make health coverage through the marketplace affordable. Just to really drill down and define who we're talking about, in Nebraska in 2025, 135,000 Nebraskans are enrolled in marketplace coverage, and over 93% of enrollees rely on these enhanced subsidies to afford their coverage. So while we're talking about just marketplace enrollees, the impact of losing the enhanced subsidies are extremely widespread. But as every speaker so far has described, the impact is not just for marketplace enrollees. Certainly, this builds on historic threats to healthcare already passed in H.R. 1 earlier this year. And we all, no matter where you get your health insurance, are going to see the impact of all of this instability and higher costs, really runaway costs for all of us to be able to access healthcare, whether you access it on the marketplace through Medicaid or through private insurance. As we've already talked about, this instability will compound negative effects. I think we were just getting to and talking about a little bit the personal health effects of foregoing insurance means foregoing preventative care, and often leaves folks with the only option of relying on emergency care, which we know is way more expensive and way less effective in treating underlying health conditions. And so we see, not just for individuals who are dealing with healthcare, as we all do every year, you can't plan necessarily when you're going to have a healthcare event. We'll see that ripple effect, and many more of our community members, our family, our friends dealing with unaffordable healthcare services, and then the negative impacts of not being able to treat healthcare in the most effective way. We also know that lack of insurance, higher rates of uninsured folks in our communities mean greater rates of uncompensated care, which will put strain on our health system broadly and acute strain on our rural health system. We know that gets passed on to hospitals and to communities. So allowing these enhanced tax credits to expire and forcing mass disenrollment will compound all of these negative impacts for Nebraskans and the health of our communities. I think one other piece of this puzzle that I think we're highlighting a bit is that this isn't actually a divisive issue among Nebraskans or among our community members. Extending the enhanced premium tax credits is wildly popular across the political spectrum. This isn't actually something that folks disagree about. We all know that we do better when folks can actually access healthcare. Again, to frame about the Nebraskans that we're talking about, we've mentioned the deep cuts to healthcare made in H.R. 1 already this year. We expect 30,000 Nebraskans to be kicked off of Medicaid alone from the changes in H.R. 1. We know that if the enhanced premium tax credits are not extended, 15,000 additional Nebraskans will likely be forced off of their coverage because it will just be completely unaffordable. And this all just doubles up. I don't want to be too repetitive, but again, I think we've already talked about most folks are seeing their premiums double. It's true that in Nebraska, we expect that to be even higher and more acute for folks in rural areas. About 25% higher than what urban enrollees are seeing is what we expect to see in rural areas. We also know that data for Nebraska shows that the counties that will be hardest hit by the expiration of enhanced tax credits are all in CD3, are all in our rural areas. And as we've described, the cost of receiving healthcare in rural areas is already so high. It's extra travel time, it's extra time off work and out of school. Adding actual premium cost to that is going to be really unmanageable for a lot of families. I also want to be really clear. I think there's some discussion about part of what happened when the enhanced subsidies took effect was that the folks who had always had access to subsidies through the Affordable Care Act saw the subsidies increase and actually made their plans affordable, which was great. And folks at incomes above 400% of the federal poverty level gained access to some subsidies. And so I think there's some discussion we've seen among our congressional delegation here in Nebraska about concern about higher income folks benefiting from subsidies. I want to be really clear that Nebraskans with the lowest incomes will be the folks hurt the most if the enhanced premium tax credits expire. Most modeling shows like a 5 times increase for folks under 250% of the federal poverty level in our state. Again, this is just totally unaffordable and will force these extreme decisions about, am I able to budget and provide healthcare for myself and my family, or do I need to see more immediate needs like making sure I get groceries, can pay rent, those kinds of things. The other thing is, when we're talking about folks at 400% of the federal poverty level, we can get a little removed from actually who that is. And to be very clear, this is not high income. When we're talking about 400% of the federal poverty level, that's $62,000 for an individual, $128,000 for a family of 4. In Nebraska, in Omaha, that's just making it. This is solidly middle income folks who, again, aren't getting, the huge tax credits that happened in the 2017 bill or in HR 1. Those really benefited folks at the very, very high incomes. Folks with middle and lower incomes, that's who really rely on these enhanced premium tax credits and really deserve Congress to stand up for them and ensure they can access their health care. One more point here, and then I'll toss it back, is that this premium tax credit issue is really a symptom of larger health system problems. There really are no guardrails on health insurance pricing or health costs, and insurance companies still require people to pay more and more and still deny care or provide less actual coverage. So the enhanced premium tax credits are just a common sense consumer protection that ensures that folks who are doing their best to work really hard and are still paying a lot just to get their foot in the door of getting the healthcare that they need are protected from some of these runaway prices. We will continue to call on Nebraska's members of Congress to extend the enhanced premium tax credits. And I know there are lots and lots of ways to take action, but Appleseed does have one-stop shop place where you can click a link and contact members of Congress. And so I'll drop that in the chat too.
Thank you so much, Kelsey, for all of that. And thank you for continuing to talk, because I had some questions that I wanted to dive into, like 400% of the poverty level, again, is $62,000 for an individual person. Everyone thinks it's like this huge dollar amount, and it's really not. And so I live in Sarpy County, and I know that the single biggest driver for homelessness in Sarpy County is medical debt. So this is something that we cannot make worse. And we need to be taking proactive steps. So like Kelsey said, we will be dropping in some contact information for our federal delegation here in Nebraska. So make sure we are reaching out to them to let them know with that. So our time is like flying by really quickly. I want to hand it over to my friend Audrey to kind of talk about some what she and her family are facing right now. So please stick around. I will have additional comments or questions for our panelists, but Audrey, you and I talk a lot, and you and I were sharing how much of an increase we're going to be seeing next year in 2026 on our monthly premiums. I was wondering if you can hop in and kind of tell us your story and why you are stepping up in this moment right now.
Okay, yeah, I think the same day I got my letter, I texted you, Angie, and said, I'm having a heart attack because our premiums went up. So my husband and I have been on the Affordable Care Act since 2019. He works for a very small employer that doesn't offer insurance. So ACA is our only way to have coverage. And the subsidies are actually what makes it affordable. The premiums a month are a lot, and it have been in the past, but with the increase this year, it's exorbitant. So we really need that subsidy to make it affordable so we can have insurance. We need to have insurance. We are not going to go without insurance. That's just not even that's a no-brainer. We need to have it. My husband has a lot of pre-existing conditions. You know, list them all, but there's a lot. High blood pressure, allergies, sleep apnea, things like that. So he just needs to have regular care to stay healthy. Our premiums, I think I put in the chat too, went up $688 a month. So our premium for a gold or a bronze plan is $2,433.27. I don't even have to look at the form anymore because I've called our elected officials on a regular basis and told them how much our premium is when I got our letter. So we rely on ACA. UNMC is right down the street from us. We want to be able to still go to that high, very reputable facility and see those doctors. And we want to have that security. We need to have that security. We're regular middle class people, like when Kelsey was talking about the dollar amounts there. I mean, we're just regular people that want to make it by. We're not expecting it for free. We just want a little help so that it is affordable. Even with our premiums, and while other people were talking, I went and looked up how much we actually spent so far this year in 2025 out of pocket for prescriptions and everything. It's about $10,000 in medical bills that we've spent this year, and we have insurance. That's out of pocket what we've spent just so far year to date for 2025. So obviously we're not getting a free ride. We have insurance. We're getting a little help with the premiums. I think this is like just my husband's bills, prescriptions and things so far this year. So, you know, we live on a budget. We want to know how much our bills are. With the subsidies being in question right now and looking at enrollment for next year, if our premiums go up, let's say $688 is the total amount, but let's just say we have to pay 500 of that. I don't know. I'm throwing numbers out there because I am too scared to actually do the enrollment for next year right now. But anyone who has bills go up $500 a month and your paycheck didn't go up $500 a month, that's going to be a problem. So we are probably maybe a little bit more well off than some of the other ACA recipients, that we can probably do something to pay that difference. I feel like I need to speak out for the people that are living with none of that cushion. There's so many Americans, so many Nebraskans that don't have any cushion to find an extra $500, $600, $800, whatever it's going to end up being a month, just to pay your insurance premiums. So I just want to, be visible as a regular person on ACA that depends on it. And I just want to speak out for those others that maybe don't realize yet how much more it's going to be. And like John was saying, door knocking, people are scared that think they might not get insurance next year. And like Angie said, it's very personal. It's very, very personal to me. This whole instability was Kelsey's favorite word, I think, today. All of this instability, the personal, I feel like this whole shutdown is an attack on me. It's an attack on me personally and everyone like me. So I just want to make sure people know that the premiums are just part of your healthcare costs, and that's going up. And we still are required to pay. I just want to be able to have insurance, have good access to the great care just down the street, and just kind of, without reiterating what a lot of the other people said, is just we need to fix the problem and continue to call our elected officials, like I do regularly, to let them know that they need to resolve this issue and stop making it a political back and forth. It's really impacting everyday Americans like me and my husband. And I just, on a kind of a side note, the Medicaid costs and the Medicaid cuts, just talking with my stepdaughters this weekend and my grandchildren, they are just finally realizing that it might impact them. They and their kids rely on Medicaid, and this whole thing is making a lot of stress for a lot of people. So I am feeling the stress for myself personally, but also my grandkids, my stepdaughters, my family, people I don't even know. So it's very personal. It's very stressful. It's frustrating that we can't, when you, like John, you said, and everyone said, it's, nonpartisan. Everyone wants access to healthcare. I don't understand why we're the only developed country without universal healthcare. So that's kind of just my quick 2 cents, Angie, and we can follow up if you had more questions. But
Thank you. Thank you so much, Audrey. Thank you so much for your voice. Thank you so much for being here today to help share your story. You got me thinking, my love language is spreadsheets. So I went out, I have a spreadsheet where I kind of collect all of our expenses for our family. And so far this year, with our out-of-pocket costs and our premiums, our family has spent $24,436.50 just on medical. I've never added that up. I didn't want to look at it similar to you. Like I don't want to go out and look at those numbers, but you got me thinking about that. So when it comes to our federal delegation, I know that you said that you talked to them quite a bit, and for a lot of us, we know that Congressman Flood was on MSNBC a couple of weeks ago talking, and they were confronting him with, due to the Medicaid cuts that were in the tax bill that was passed, the HR 1 earlier this year, that Nebraska was facing, where we were looking at losing 2 hospitals within the state of Nebraska. But they confronted him with the fact that because of the implications of that tax bill, that now the number is 6. And his response was that maybe the healthcare system, maybe those hospitals really need to change their structure from what they're doing today to just strictly doing emergent care. What is your response to that? Do you have faith that our congressional delegation is going to do the right thing?
that's for me.
Yeah.
No, unfortunately, no. All of the calls that I've made, I live in Congressional District 2, so I've been focusing on Don Bacon and our senators, but I don't feel that they are listening to what we're trying to say. I don't have any faith that they are going to do anything. The prior discussions that Bacon has said over the years, he's always attacked ACA. He's always said that he didn't like it. And he's hinted that people are taking advantage of the system. People that make too much money are getting too much help. And I know that in some of the calls with Ricketts in his office, they feel the same way. I think they think that instead of the tax breaks for the billionaires and the millionaires, which that really is rich people taking advantage of the system, I think they think that there are everyday Nebraskans taking advantage and getting subsidies. And I don't understand where the math is for that. And so, no, I don't trust them in really listening to our stories, unfortunately.
Thank you for that. We only have 10 minutes left today, and I do want to leave a little bit of time for Emily at the end. Actually, Emily, I'm going to throw it to you really quick because I know that you and I were having a conversation earlier today, that you had a conversation with your grandma. Can you tell us about that conversation that you had?
Yeah, so as a program, Nebraska For Us is focused on finding storytellers like Audrey who can share their message, because although we do feel like we're not listened to, it's one of the only things we can do, along with getting together in communities, sharing our stories and listening to each other and uplifting each other's voices. So I was talking to my grandma yesterday about what her healthcare premium increases would look like. She said that hers are going up $400 a month. And for me, like, that is personal for me too. Like, I was so scared, and I know she will be able to find a way to make that work, but she was saying that she has pre-existing health conditions, like she's had open heart surgery before, she has asthma, she's 83 years old. Like, she was saying that she doesn't think that another insurance company would be willing to cover her. And so she'll have to find a way to make it work, like taking out of retirement savings. But it's stressful and it's personal. And that is just one piece of what each of our stories could look like, is sharing how we feel when we hear about others who will be struggling to afford health care. So we are having a storyteller event later this month, actually next Wednesday, where people who have a story about healthcare or cuts to food assistance or rising costs in general, where we're asking people to speak up about their story or speak on behalf of others whose stories affect them personally, like your neighbors or your grandmother. So I'll drop that link in the chat, but that's a Storytellers and S'mores event. It's also a coat drive for North Omaha Community Partnership. And we're hoping to collect new coats for middle school and high school kids, adult sizes. We would love to see you there. It's in Midtown next Wednesday from 5:30 to 7:30. I'll toss it back to Angie for any other event promotion or final wrap up.
So I kind of promised that we'd get to some questions. So I'm going to hand it over to Colin that's been monitoring our chat with some of those questions. So Colin, can I hand it over to you to kind of go back to our panel and ask some of the questions that were in the chat today?
Absolutely. And actually, shout out to Chiquita. She has been in real time responding to some questions in the chat there. So definitely appreciate that, and would invite all of you to look in there as well, just to see some of the insights that she shared from her experience. But one of the questions that has not been answered that I think is of interest, especially from a state lawmaker's perspective, Senator Fredrickson, we had a question from Tracy asking what some colleagues from, she says CD3 in here, so looking more at like greater Nebraska and some of the more rural state senators, if there have been any thoughts that they have potentially shared with you about subsidies being lost or concerns about healthcare access, or maybe you're hearing from some of their constituents who maybe aren't feeling heard on their end from their senator. This just kind of came in, so obviously we haven't had a chance to talk about it, but would love to get your read on this and what you've been hearing, especially as we get ready for the next session to start in a couple months.
Yeah, that's a great question. So, and I think this was highlighted earlier, and if it wasn't, I certainly want to ensure it's highlighted. The parts of Nebraska that I think are going to be most significantly impacted by these changes are certainly the rural parts of the state. So, when you think about my colleagues who do represent those parts of the state, I mean, this is their constituency that's going to be most affected. I think it's a bit complicated. What I mean when I say that is that there are a couple things going on. So for folks who have been following some of the federal stuff going on, there's currently been application processes. I believe they're due this week for the Rural Health Transformation Program grants. And so I hear a lot of colleagues talk optimistically about Nebraska's application for that. I think that sometimes that's a bit simplistic. And what I mean when I say that is that I think maybe this magical thinking that those funds are somehow going to solve these issues. And these are two very, very separate things, to be clear. So there is a possibility that Nebraska will be receiving some federal funds for rural health transformation. That is exactly true. And that's something I would certainly support and hope that does occur. But that does not translate directly to how are these constituents going to be impacted by what's happening currently with their own personal healthcare coverage. So those are two separate things. So those are conversations that need to continue. We're not in session right now. So for my colleagues who are in the western part of the state, we don't get to have those sort of conversations in the hallway as frequently as we do when we are in session. But as we are getting into the fall season and we're preparing for next year, I am having more contact with colleagues from across the state, and these are certainly top of mind. So there is, I think, a little bit of a disconnect between the reality of what's happening currently and maybe what might happen with future funding, and how that's not necessarily the same thing, if that makes sense.
It definitely does. Thank you, Senator. And that was the primary question that wanted to make sure we got back to. And just to reference what Angie just shared in the chat, we will have a recording of this virtual roundtable available this afternoon. I know that 1011 in Lincoln and KETV in Omaha are on here, so I'll be sharing a link to the recording this afternoon so that you can use this for any upcoming coverage, and we'll have a larger release that'll also go out later this afternoon as well and go on our website, nebraskaforus.org, so that anybody who couldn't make it, and maybe you know someone who couldn't make it, would like to watch this or to get more insights, we'll be able to have that all out and available to everyone who attended today. Angie, do you want to send it back to you to close things up since we are right about at time?
We are right about at time, and I want to thank everybody that was able to participate on the panel, but I do want to toss it back over to Chiquita Brooks-LaSure to kind of do some final ending comments of where our focus should be, where do you find hope within the federal delegation, and just some parting words for us today.
Sure. I will say that I think for many of us, this is a very difficult time, and I really want to say, particularly to Audrey and to Emily, thank you for sharing your stories, and just to say how much this affects, as everyone has been talking about, real people and real lives. I would say that even though it can feel frustrating when you feel like the members aren't hearing you, I just continue to say thank you. People need to hear from real people. And one of the big things has been not knowing who the ACA face is. And so really sharing that. And I thought what you said, Audrey, about really helping people to understand that 400% of the poverty level is not rich is one of the most important things that we need to get across. That hardworking Americans are struggling to pay for healthcare costs, and we need to do more and need to get back to that. To try to say something inspiring, I'm behind the ACA. Much of my career has been working to get the ACA passed, and I will remind all of us, which I've been reminded of, that the ACA passed in a very difficult time for our country during the beginning of the Great Recession. And a lot of people didn't want to do healthcare, but healthcare was such an important part of the economy. And that was one of the reasons why then President Obama and Congress was able to get it through. And I hope that in this moment of real difficult pain for across our country on a number of factors, that even though we are fighting this fight, that people see that it is critical that we address costs for the American people, and healthcare is a big part of that. And I have hope that through the work that all of you are doing, that we will get that message across, if not in the next 2 weeks, over the next year, because none of this is inevitable. I hope that was inspiring.
Thank you. Thank you so much.
I'm inspired by all of you. I will say, just thank you, Senator, for your service, and for all of you again for sharing your perspectives and working hard on the ground to change our country.
Thank you so much. And with that, I want to say thank you to everyone that attended here today, and look out for other events for you to join in on and continue this conversation. And we appreciate you so much for really showing up today and listening and hanging out with us for the last hour. So we'll give you back the rest of your day. For all those that are here in Nebraska, it's a top 10 day. Please go out and find some sunshine and touch some grass. So we'll talk to you soon. Thank you. Bye.